of doctors on a strike in Mumbai, where poor health care facilities and hospitals are well documented, but fresh visuals clearly shows about how the hostels of resident doctors in Mumbai have revealed their deplorable living conditions and tagged warriors and heroes during the pandemic. These resident doctors allege that they are forced to stay in crowded hostel rooms with cracked walls and unhygienic conditions. Remember, almost 7,000 medicos, including 50% from Mumbai's Chem, BYL Nair, Sion, RN Cooper and Sira JJ group of hospitals are on strike. Their agitation is over a range of issues, including the quality of hostels and filling up of the vacant posts of the assistant and associate professors, as well as a payment of arrears. The resident doctors have decided to boycott the OPD services, but have said that they will continue to work in the emergency. However, they are yet to hear from the government officials as far as establishing a dialogue to hear the demands of the doctors who are protesting right now, whether at all the administration wants to fulfill those demands so that the doctors can call off their strike. My colleague Ashweta is joining me live right now to get us more details. Ashweta, you have been speaking to all these doctors who have been on a protest, and their demands are very specific. They want their arrears, they want the vacancy and the assistant and associate professors' posts should be fulfilled. They want practically just better hygienic living conditions in their hostels. Has there been anybody from the administration who's willing to even hear what the doctors demand so that this protest can be called off?
Well, Samya, unfortunately, it's been 48 hours and no conversation between the administration and the resident doctors. Now, remember, MAD had given the ultimatum 8 days prior launching the strike, which they have done yesterday. And today is day 2 of the strike. And the Maharashtra Association of Resident Doctors had well informed the administration that because their demands have not been fulfilled yet, so they will be going on mass leave, which will be leading to the peaceful demonstration and strike. But this went unheard, in fact falling into the deaf ears of the administration. And today we are seeing that in large numbers these resident doctors are out on strike, demonstrating and protesting for their needs, which are quite specific, as you have mentioned. Now here it is important to note that 8 months COVID airways have not been given. Also, there are more than 1,432 senior doctors vacancy which has to be yet fulfilled, which has not been done by the administration. Now, thirdly, it comes to the equal pay to the state-run hospital and BMC-run hospital. After this, we also know that because of the teaching faculties, there are less teaching faculties, in fact, in the medical colleges, due to which the burden is on the resident doctors. So, to fulfill the vacancies of associate professors and assistant professors, this is one of the important demand what they have kept forward. But nothing seems working. In fact, very importantly, they have also spoken about the fact that the basic hostel facilities are also not in place, Samya. The kind of visuals what we have got for our viewers exclusively clearly shows the apathy. In fact, the resident doctors in one single room, 6 resident doctors live. They don't have proper place, no proper sanitation. In fact, the walls are leaking, the ceilings are falling apart, the washrooms aren't even clean. In fact, the kind of visuals what we have got through our sources from various hostels of JJ, of KEM, of Nair Hospital, it shows that the resident doctors are really living in poor conditions after working tirelessly round the clock. When they need some peace, when they go to their hostel, there is typically a terrible situation what they have to face. And this was the prime demand, in fact, kept. We also spoke to female resident doctors, and they have also stated that there is no proper sanitation, in fact, for them. And while working in the hospital for more than for more than 10-12 hours, we do find out that they don't have, in fact, proper cleanliness place for themselves. And here it has been seen, Samya, that it's already been 2 days, but again there has been no assurance from the administration end that by when can they meet some of their needs, not exactly fully, but some of their needs which are very important, which includes the hostel facilities. So yes, quite unfortunate on the part of resident doctors that they have to come out and carry forward this strike. When we speak on the medical facilities and the services are being hit or not, well, the data showed that it is a minor effect what has been done on the entire medical facility level. But yes, there's definitely more of pressure mounting up for the senior doctors as their helping hands. Those who are the resident doctors have taken back their services, and only the emergency services are running in the state-run hospital and BMC-run hospital. These are very important hospitals. In thousand in numbers, in fact, patients do go there. But here we are seeing as of now, but there are quite minor changes. But yes, we do see that the impact is more in the terms of pressure for the senior doctors. Samya.
Well, thank you, Shweta, for getting us all those details and an exclusive sneak peek into the conditions in which the resident doctors are living in. What do these doctors want? They want 8 months worth of arrears that has not been given to them. They want hygienic, livable condition, a life of dignity, and they want equal pay. We hope that the administration in Maharashtra is going to come on the talking table and at least hear the grievances of these doctors with the frontline workers and touted to be heroes when they were working day and night to save lives. Of course, now they want their rights, their voice to be heard.